Hi, Jack.
Hi, Dr. Matt.
How are you doing today?
Doing great.
Wonderful. Thank you so much for coming in. So I see here that we have a 4 o'clock appointment.
Yes, we do.
Okay, perfect. And you're here for a heart exam?
That's correct.
Okay. Perfect. So we're going to do a cardiovascular examination. Now, please tell me, have you had any symptoms?
I have not had any symptoms.
Okay. So you're here just for a general checkup and
Correct.
you want to make sure that your heart is functioning properly?
Yes.
Perfect. Okay, I'm going to ask you a few questions just to make sure that I have the right information. Do you have any allergies?
No allergies.
Okay, wonderful. And your medical history, it shows here that you did have hypertension in the past. How was your blood pressure in the last month or so?
It's been good. It's within the range 80 over 120, so we're in
Okay.
the safe spot.
Okay. And you're taking your medicine as prescribed?
That's correct.
Okay, good. Wonderful. Okay, have you had any signs of discomfort, breathlessness?
No signs of discomfort.
Okay, good. So what I'm going to do now is I'm going to take your vital signs, your blood pressure, your oxygenation, your heart rate, and after that I'm going to go ahead and do a very thorough examine you.
Sounds good.
Great. Okay. So can you please tell me today's date?
Yes, it's March 28th.
Okay, wonderful. And who's the President of the United States?
Joe Biden.
Okay. What's 3 minus 1?
2.
Wonderful. Okay. Okay, Jack, so what I'm going to do is first I'm going to examine your overall appearance and your skin as well. I am noticing normal skin perfusion. Your skin is dry. I'm not noticing any sweat. Also, I'm looking around the mouth. I'm not noticing any cyanosis, which it would be a bluish discoloration, so that means very good perfusion. Also, I'm noticing that you're breathing normal and your skin is appropriate to ethnicity, so that's very reassuring. Next, I'm gonna go ahead and take your temperature.
Sounds good.
Okay, this is gonna go on your forehead. Okay. Okay, so your temperature is 98.3, which is normal. And this is gonna go on your index finger. Let me just turn it on. So can I please have one of your index fingers? And I'm gonna ask you to relax, breathe normal. So your heart rate is 64 beats per minute and your oxygenation is 98% on room air, which is very good, within normal limits. Okay. So I'm gonna go ahead and take your blood pressure. Do you mind if you take your shirt off?
Not a problem.
Okay. You can keep the t-shirt on. Okay, let's go ahead and use the right arm. Is this arm okay?
Yes.
Okay, good. Okay, do you mind holding this for me just like that?
Not a problem.
Thank you. And relax your arm. Perfect. Okay, that is good. Okay, very good. So your blood pressure is within normal limits. 125/60. Okay, so blood pressure 125/60. Heart rate was 63. Oxygenation was 98% on room air. And I wasn't able to notice any signs of discomfort, no breathlessness, no cyanosis, no pallor, and no tachypnea. I'm gonna go ahead now and to check your arms and your hands. Okay, so I'm gonna start with your left arm. Okay, I'm checking for edema. Okay, I'm gonna go ahead and press down. Okay, so I'm not noticing any pitting edema. And I'm checking the palms. Okay, go ahead and turn. Perfect, thank you. Good. Okay, so I'm not noticing any clubbing, no peripheral cyanosis, no cigarette tar staining, and also no splinter hemorrhage. I'm gonna go ahead and check your capillary refill. Okay, good. So capillary refill is within 2 seconds, which also indicates very good peripheral circulation. Wonderful. Let's go ahead and check your other arm. What I'm gonna do is the same thing. I am gonna check for pitting edema, so I'm going to just gently press down for 1, 2, 3, 4, 5, and release. So I'm not noticing any indentation, which is very normal. I'm gonna go ahead and check your palm now. Good. Okay. Perfect. And let's go ahead and check your nails as well. Okay. Perfect. So again, I'm not noticing any cigarette tar staining, no splinter hemorrhages, no peripheral cyanosis. Capillary refill is within 2 seconds, and also no clubbing of the nails. Good, wonderful. Okay, relax. What I'm gonna do now is I'm going to check your pulses, and I'm going to start with the radial pulses, which is right here on your wrist. Okay, so first I'm going to count for at least 15 seconds. 1, 2, 3. Okay, very good. And what I'm going to do now is I'm going to compare both wrists, make sure that they're synchronizing. Perfect. Okay, very good. What I'm going to try to do now is I'm going to try to locate a brachial pulse, which is right here. Okay. And if I am suspecting a collapsing pulse, I'm just going to very fast raise your arm above your head. So just let your arm loose. Okay, everything is normal. Okay, so what I'm going to try to do now is I'm going to try to locate your jugular venous pulse. I'm going to put 2 fingers right here in between the 2 heads of the sternocleidomastoid muscle. Okay. Good. Gonna do the same thing on the other side. Okay. Very good. And I'm gonna try to listen. Okay, so just relax for me, please. Good. Can you hold your breath for me, please? And breathe normal now. Okay, Jack, so what I'm going to do now is I'm going to check your eyes. Can you please look right here at my nose? Okay. Good. Look right here at my nose. Okay, very good. Gently, I'm going to press down on your eyelid and look down. Look down. Okay, look up. Perfect. Look to your left. Good. Right. Perfect. Sorry about that. And I'm gonna go ahead and do the same thing on the other side. Okay, look up, look down, look to the right, and to the left. Perfect. Okay. Can you please pinch your nose and hold your breath? I'm gonna come a little bit closer to you and I'm going to check your retina. Okay, so I'm not noticing any abnormalities. The optic disc is intact. Wonderful. And I'm going to go ahead and do the same thing on the other side. Okay, very good. Can you please look down, look up, okay, look to the left and to the right. Okay, good. I'm not noticing anything abnormal with your eyes. Let's go ahead and check your mouth. So like I said, no bluish discoloration around the mouth. That's good. And if it's okay with you, I'm going to check your denture. I want to make sure that there is no bacterial gingivitis or anything abnormal with your teeth. Okay. So what I'm gonna do is I'm gonna ask you to give me a big ah. Okay, very good. Good. Can you please move your tongue up and down and side to side? Wonderful. So your tongue is very well perfused and midline, so that's good. Now I'm gonna go ahead and tap on each individual tooth. Okay, let me know if you feel any kind of pain. So far, I'm not noticing any cavities. Salivary glands are not inflamed. I'm not noticing any lumps. Okay. And the gingiva looks very healthy. No signs of infection. No inflammation. No purulence. Wonderful. Okay, Jack, next thing that I'm going to examine is your chest and your abdominal area. Is it okay if you take the shirt off and I examine you?
Sure.
Perfect. Okay, so I'm not noticing any abnormalities. Your chest is symmetric, you're breathing normal. What I'm going to do now is I'm going to ask you to lay down and I'm going to do palpation, percussion, and auscultate your chest.
Sounds good.
Okay, so I think the head here would be good. Try to localize the heart and I'm going to feel for any vibrations. Okay, good. I'm gonna go ahead and gently tap on your chest. Let me know if you have any pain. Okay, this method is called percussion. And what I'm trying to do is to elicit different sounds. And if I hear anything abnormal, it may mean fluid that is not supposed to be there, an enlarged organ, or a mass. Okay, so I'm doing a very thorough chest exam, not just a heart. Okay, I'm going to go ahead and gently palpate your abdomen. Gently let me know if you feel any kind of pain. I'm not noticing any enlargement. Okay, and I'm gonna go ahead and listen to your heart. Okay, good. So I'm going to listen over the tricuspid, pulmonary, and the aortic areas. Okay, and I'm able to hear only S1 and S2. No S3, no S4. Okay, I'm gonna go ahead and listen with the bell now. Okay, I'm not hearing any murmurs. Good. So I'm not noticing mitral regurgitation. That's good. And in this position, I'm going to ask you to look to your right. Perfect. And we're going to listen to the carotid artery. Good. Okay. And now I'm going to ask you to look the opposite. Perfect. Okay, very good. Finally, I'm going to check your tibial pulse. Is it okay if I take the socks off? Okay, good. Okay, so what I'm gonna do is I'm going to check for beating edema. And the way to check that is behind the ankle. I would press down 2 fingers for 5 seconds. 1, 2, 3, 4, 5, and release. And I'm not noticing any beating edema. Maybe just a little bit higher now. 1, 2, 3, 4, 5. Very good. So no beating edema in the left leg. 5. Wonderful. I'm going to go ahead and check your tibial pulse now, which is right behind your your ankle, and on the other side. Good. And we're going to check the dorsalis pedis as well, which is right here. Good. Okay. And we're going to do that on both legs. So I would say your pulses are 2+, strong and symmetric, and overall very good peripheral circulation. Let's go ahead and check your capillary refill. Okay. Capillary refill is within 2 seconds, very normal. I'm not noticing any abnormalities. Overall, I would say good peripheral circulation. Okay, and normal temperature. Okay. Good. Excuse me. Okay, Jack, so everything looks normal from the cardiovascular stand-off point, and thank you so much for allowing me to do this medical exam on you. Do you have any questions for me?
No questions.
Okay, wonderful. In that case, I'll see you back soon.
Sounds good.
Thank you.